Hello, and thanks for joining us for the Pharmacy Cannabis Lecture Series. Every episode is a great opportunity to learn about cannabis and hear from great speakers. My name is Candace Hawes, and I want to thank all of our viewers and our customers for being with us today, especially our customers from the Pottery, from the Pharmacy Santa Ana, Santa Barbara, and Berkeley. Today, we're going to be talking about endometriosis. It's shocking to know that it's estimated that 1 out of 10 women between the ages of 15 to 49 will be affected by endometriosis during their lifetime. This equates to about 176 million women across the world. Yet endometriosis remains one of the most misdiagnosed and least understood medical conditions currently, and there is actually no cure for endometriosis. However, cannabis does offer hope as a treatment for endometriosis. A growing body of research suggests that there's a profound link between cannabis and endometriosis. Endometriosis causes major inflammation, which is one of the reasons that individuals experience pain. Cannabis, as we know it, is known to have anti-inflammatory and pain-reducing properties. Cannabis can also affect cell death and growth, calm gastrointestinal issues, reduce nausea and vomiting, and is also a natural sleep aid and can help reduce the stress associated with flare-ups. To discuss this topic today, we have 3 great guests. We have Dr. David Behrman Md, who has treated many endometriosis patients in his 40 years of his medical practice, and Carrie Mapes and Patty Pappas, the founders of Hello Again. Our first speaker will be David Behrman, MD. I first met Dr. David Behrman many years ago when I worked at a medical cannabis office in the early 2000s. He was one of the first doctors providing cannabis recommendations, taking the risk to provide patients the medicine that they needed. He's now retired, but he had a long, successful career in medicine. In his 40 years practicing, Dr. Behrman worked in public health, administrative medicine, primary care, pain management, and also in cannabinology. Dr. Behrman is the retired executive vice president of the American Academy of Cannabinoid Medicine. He's also the author of several books on the history of the medical use of cannabis. Cannabis Medicine, A Guide to Practical Cannabinoid Medicine, and the second is Drugs Are Not the Devil's Tool. Dr. Behrman has also been featured in a documentary, Medical Cannabis and Its Impact on Public Health. After Dr. Behrman delivers his presentation on endometriosis, we'll hear from Patty and Carrie. Patty and Carrie go all the way back, about 20 years, when they met when their oldest children just started preschool. They've been friends ever since, and Patty and Carrie have always been adventurous and open-minded. But it wasn't until they became empty nesters that they just decided to explore the local dispensaries. Quickly, they realized that cannabis was uniquely suited to address many of the challenges they experienced during menopause. The skills and lessons that they had learned as mothers, wives, and leaders in their communities are now applied to the world of cannabis and business. Carrie's creativity combined with Patty's attention to detail make them the perfect pair to spearhead a movement to educate women about menopause and the non-psychoactive use of cannabis for wellness at any age. Carrie and Patty founded Hello Again in 2019 after extensive research and development. The duo is committed to offering solutions for women to improve both mental and physical health and feel like themselves again. And this is my favorite part. I love their slogan. Their grandmothers tolerated it, their mothers medicated, and they created Hello Again. So I love that. So today we're going to begin with Dr. Behrman with a presentation on the endocannabinoid system, retrograde inhibition, and how cannabis works to decrease the symptoms of endometriosis. Then we'll hear from Patty and Carrie about their journey to create a product for women with endometriosis, also with PMS and with menopause. So with that, I would love to start first with the presentation from Dr. Behrman. I had a chance to review his slides, and he's got a lot of great information for you guys. So thank you, Dr. Behrman, for being with us today.
Well, thank you. It's a pleasure to be here with you and with the 2 entrepreneurs. I'm sure that you, all 3 of you, know a lot of what I'm going to cover, but some of the people in the audience may not. So let's, here we go. So, I am. Okay. So This is a very brief bio of mine. As Candace said, I've written several books, run right out of Mayam. I was named Doctor of the Day by the Wall Street Journal, and I practiced for 21 years doing cannabinoid medicine, along with a number of other jobs that I've had in my career. I also was an expert witness and testified in 500 cases, more than 500 cases, and taught at UCSB, UCSF, and San Diego State, where I was the director of the Student Health Center. Okay, so what are we going to talk about here? A little bit about the history of cannabis for pain. Then we're going to talk about what endometriosis is, what menstrual cramps are, a little bit about the plant, the endocannabinoid system, cannabinoids, terpenes, and medical implications. So let's get learning. There have been over 30,000 articles on cannabis, cannabinoids, and the endocannabinoid system published in peer-reviewed medical journals since 1995. There are some good books out there in addition to mine. Dr. Deborah Malka wrote a book called Medicinal Cannabis, Pearls for Clinical Practice, and Dr. Goldstein, whose book is called Cannabis Medicine. Let's move on. So pain is the most common complaint that brings people to the doctor. And we've got a problem today with overprescribing of opiates, which has sort of contributed to the opiate phobia. And cannabis is used as an exit drug. There's at least 4 states that have approved cannabis for opiate use disorder. And what's interesting about the use of cannabis for pain is Dr. Nora Belko, who's the head of NIDA, and was previously a pretty voracious critic of cannabis as medicine, said at a meeting of substance abuse doctors that cannabis should be the first choice for pain. Well, let's talk about how that came about. Okay, so cannabis has been used for treatment of pain since probably before recorded history. The first pharmacopoeia that it's thought to have been in was the Ping Chao Ching, the plowman's medical handbook, which was by oral tradition written in 2637 BC. Whether or not that's the case, cannabis has been around for a long time. And the ancient uses of cannabis were for pain and childbirth anesthetic, treating migraines, indigestion, insomnia, as well as menstrual cramps. I just throw this in there because Queen Victoria used tincture of cannabis, certainly in the 1890s, prescribed by the royal physician to treat her menstrual cramps. So you're not the first. Okay, so let's see what we're talking about here. What is endometriosis? Endometriosis is pelvic pain that's caused by endometrial tissue. That's the tissue that should be inside your uterus, ending up outside the uterus. It may be found on the ovaries, the fallopian tubes, and the pelvic floor. It is stimulated to become engorged with blood by estrogen, as is the endometrial tissue inside the uterus. It may also cause pain and inflammation. Cannabinoids and terpenes are useful in providing pain relief and in downregulating the immune system. And this is why it's useful both in treating endometriosis and in treating menstrual cramps. So some causes of endometriosis. As I said, there can be endometrial tissue in the pelvic floor, the ovaries, the fallopian tubes. It can come from retrograde menstrual flow, which is the menstrual blood going out the fallopian tubes into the pelvis. It can come from peritoneal cells being transformed into endometrial embryonic cells and end up outside the uterus. The lymphatic system can transport endometrial tissue. That shouldn't be system, that should be tissue. The immune system disorders can cause it, and something called adenomyosis. Let's move on here. So what are some symptoms of endometriosis? As I said, you have a response of the endometrial tissue to hormones, to the female hormones. The endometrial tissue can grow on pelvic structures such as the ovaries, the fallopian tubes, suspensory ligaments of the uterus, and the pelvic floor. This endometrial tissue becomes painful and swollen, particularly around the time of a woman's period. The endometrial tissue inside and outside the uterus is stimulated by the female hormones. So, what are the treatment options? There can be surgery to remove the epidemoid tissue, and that is done sometimes. Treat the associated pain, which is what we're mainly going to focus on here. Conventional treatment includes nonsteroidal anti-inflammatory drugs and opiates. THC and terpenes are what we're going to talk about today. Hot baths sometimes may be helpful. The patient should be checked for immune system disorder, and you should also treat it if you find it. Okay, so let's talk about menstrual cramps, because oftentimes endometriosis and menstrual cramps, I'll get it straight here, are confused with each other, and there's a reason for that. The pain of endometrial and menstrual cramps are often conflated. Menstrual cramps, in fact, can be caused by endometriosis. The main cause of menstrual cramps is considered to be fluid retention caused by swelling of the uterus. Inflammation and pain can be helped by taking diuretics, which help a woman or man get rid of the excess fluid. 50 milligrams of CBD twice a day can address this swelling. The CBD helps to downregulate the immune system. The THC, on the other hand, is useful in treating pain, and we'll get down to that. So, menstrual cramps, dysmenorrhea, are throbbing pain in the lower abdomen, and uterine fibroids and endometriosis can cause menstrual cramps. Pelvic inflammatory disease, cervical stenosis, and prostaglandins trigger uterine contractions, which can be painful. Okay, so we talked about the throbbing pain. The pain starts 1 to 3 days before your period and can last for 2 to 3 days. It may be a sharp pain, it can be a dull, continuous pain. It's pain that often radiates to the lower back and the thigh. So, what about cannabis for pain? As you've seen from the history slide, cannabis has been used to treat pain for thousands of years. This includes pain related to menstrual cramps and endometriosis. In fact, well into the 20th century, cannabis was the go-to treatment for pain. At the turn of the 19th to 20th century, it was the third most common ingredient in patent medicine and prescriptions. I'll discuss a little bit about the plant and the endocannabinoid system and how they function in treating pain. Cannabis was also in the United States Pharmacopoeia from 1850 until 1942. And in the 1920s, American physicians wrote 3 million prescriptions a year that contained cannabis. So this is nothing new, and we know that it treats pain. As a matter of fact, when cannabis was taken out of the USP in 1942, we saw the beginning of problems with opiate use disorder. So cannabinoids and terpenes can treat both pain and inflammation. So whether your menstrual pain is endometriosis or menstrual cramps, cannabis may be helpful in ameliorating the cause of this menstrual pain. So in order for THC to have pain relief, you probably need about 15 milligrams. The reason I know that is that I prescribed legal THC, Marinol, and I found for my patients that 5 or 10 milligrams didn't really cut it. 15 milligrams did. However, about 10%, 10 to 15% of the patients got dysphoria. That is a feeling of uncomfortable disconnection with reality. So it might also be wise to take an equal amount of CBD. This partially blocks the euphoria or dysphoria that can come from the THC, and it partially blocks the CB1 receptor, which decreases the euphoria. And as I said a few minutes ago, CBD is an anti-inflammatory. and it downregulates the immune system. And this can contribute significantly to the pain relief that you get. Okay, so we've gone through the ancient history here. Modern history with cannabis starts with Dr. Raphael Mechoulam, the grand old man of cannabis. He characterized the structure of delta-9 THC starting in 1964, and he was one of the many scientists who was involved in characterizing the endocannabinoid system in the late 1980s and early 1990s. So the endometrial system is found in all mammals, including the human body. It's central to homeostasis, that is keeping the body sort of regulated and online. It is the largest neurotransmitter system in the human body, and it interacts with the dopamine system, and this causes something called retrograde inhibition, which I think we'll talk about later, and it modulates the speed of neurotransmission. Okay. The endocannabinoid system is 600 million years old. It's a neurotransmitting system in the human body, critical in homeostasis, modulates the speed of neurotransmission. There are at least two neurotransmitters, anandamide and 2-AG, that occur naturally in the human body, two enzymes that metabolize these, two principal receptors, the CB1 receptors and CB2 receptors, and the cannabinoids interact with the dopaminergic system. We'll talk about that in a few minutes. So what's the mechanism of action of retrograde inhibition? And this is really important because it decreases the speed of neurotransmission, and it decreases the number of pain stimuli that are going to the brain. So the endocannabinoids from the postsynaptic neuron, and I got a little slide that demonstrates this in a second, go backward, retrograde, to the presynaptic neuron. This causes release of dopamine. So why do we care? The dopamine causes reversal of electrolytes in and out of the presynaptic neuron. This depolarizes the presynaptic neuron. Depolarization makes it more difficult for subsequent neural impulses to stimulate the presynaptic neuron. Sorry for the misspelling. Thus slowing the speed of neurotransmission and decreasing the number of pain stimuli that make their way to the brain. And here's a diagram that shows you retrograde inhibition, where the postsynaptic neuron sends the cannabinoids back to the presynaptic neuron, and then you have the decrease in the or change in the electrolytes, which slows the speed of neurotransmission. This is a PhD from Johns Hopkins, and he has pointed out that there's a lot of complex actions to our immune system, nervous system, and as he says, virtually all of the body organs. The endocannabinoids are literally a bridge between mind and body. By understanding this system, we begin to see a mechanism that could connect brain activity and states of physical health and disease. And certainly that is the case with the treatment of endometriosis and/or menstrual cramps. So the cannabis plant is pretty complicated. It has at least 512 molecules, about 150 cannabinoids, which is 21 carbon molecule that can either stimulate or block the CB1 or CB2 receptors. And there are over 200 terpenes, plus several phenoids and flavonoids. So here are some health benefits of cannabis. Analgesia and anti-inflammatory are two that we're going to talk about today. It also is useful in treating anxiety. As a matter of fact, my late father's 1927 Remington textbook of pharmacy says that cannabis is useful in treating pain and anxiety. It's also an antioxidant. It's anti-proliferative, which means it's helped treat cancer. It's send it into remission, and it's also useful in neuroprotection. That is, if you get a traumatic brain injury and you've taken cannabis, you'll have less damage to your brain neurons than if you don't have cannabinoids on board. So, what are the mechanisms of action for analgesia from cannabis? There are two pain interpretation centers in the brain. One is mediated by the endocannabinoids, the other by the endorphins, that is the opiate-like substances that are made by the body. Increasing cannabinoids decreases pain perception. Decreasing the speed of neurotransmission causes fewer pain stimuli to go to the brain, and the analgesia is also helped by the downregulation of the immune system. There's something called the entourage effect, which is present in all plants because plants are complicated. Uh, Shula mentioned it in 1999. It's the various constituents of the plant acting in concert. Uh, Basically, the effect of the whole is greater or more effective than the sum of its parts. Many plant constituents, cannabinoids, terpenes, and flavonoids, acting together to cause therapeutic benefit, that is the entourage effect. The plant, the whole plant, and nothing but the plant is what they in Australia, which has the second oldest protestable in the world after Hempfest in Seattle. Okay, so terpenes give cannabis its distinctive odor. Cannabis contains over 200 terpenes, and many terpenes have therapeutic value. Here's a definition of terpenes and terpenoids. We'll sort of skip that, but it's found in a lot of plants. It's found in spices, found in flowers. It's very common. Cannabis terpenoids that are phytotherapeutic agents include linalool, beta-caryophyllene, which is found in pepper, uh, nerolidol, which is in oranges, limonene, which is in lemon and limes, myrcene, which is in mangoes, and alpha-pinene, which is in pine. Okay, anti-inflammatory terpenes include many of those that I read off. And we're getting to be more and more sophisticated and understanding that it's not just the THC, it's not just the CBD, but it's other cannabinoids as well as many terpenes. So the analgesic terpenes, again, are numerous. And I won't bore you with mentioning them, but you can always check that out on the internet. And these are some of the health effects of cannabinoids. And you can see that THC, THCA, CBDA, and CBG, a number of other cannabinoids have therapeutic value. When cannabinoids are in the acid form, they do not cause euphoria. So there's William Courtney is sort of the expert on juicing cannabis, raw cannabis. And if you juice raw cannabis, since the THCA is in the acid form, there's no euphoria. So the THC has a lot of different health benefits. It can help treat cancer, possibly even send it into remission. It's an anti-nauseant. A lot of people have nausea with endometriosis and menstrual cramps. It's analgesic, appetite stimulant, antispasmodic, muscle relaxant, and so on. Okay. Okay. And as I mentioned, cannabis has a lot of health benefits. Now, we were talking about anti-inflammatory, CBD, THCA, CBDA, CBN, CBC, CBG, and CBGA all can downregulate the immune system. Jump down to the bottom, and analgesic properties are held by THC, CBD, CBC, and CBG. So there's a lot to learn here, and hopefully your dispensary will have bud tenders who know some of this information. And if you run a dispensary, you might want to buy my book, Cannabis Medicine, A Guide to the Practice of Cannabinoid Medicine, which has some of the same information in it. CBD for menstrual cramps. CBD may reduce the inflammation related to menstrual cramps, as well as from endometriosis. The dosage for decreasing inflammation is 50 milligrams of that shouldn't be milliliters, that's milligrams of CBD twice a day. CBD downregulates the immune system. While research is limited, CBD's anti-inflammatory and pain-relieving properties may provide relief of menstrual cramps. And I have seen a lot of patients for endometriosis and menstrual cramps, and many of them have gotten relief from cannabis. So CBD has, I think, even more health benefits than THC. It's anti-inflammatory. It treats autoimmune diseases like psoriasis, Crohn's disease, rheumatoid arthritis, fibromyalgia, and systemic lupus erythematosus. Move on. So CBD, as I said, has uh, anti-inflammatory properties. Low doses of cannabinoids can stimulate the creation of new nerve cells in animal models, even in aging brains. I don't know about that in there. But CBD has been shown to block the enzyme that destroys bone building compounds. And when applied topically as an infused lotion, serum oil, or salve, the antioxidants in CBD, a more powerful antioxidant than vitamin E and D, can repair damaged skin. Doesn't have anything to do with endometriosis or menstrual cramps, but it's nice to know that you can get a variety of therapeutic benefit from CBD. Now, let's see if I can find the arrow here. CBG, we're learning more about that. It's also an analgesic and has a couple of other benefits. So why is there such broad benefits from cannabis? It's because the endocannabinoid system is the largest neurotransmitter system in the human brain. It's critical for homeostasis, modulates the speed of neurotransmission via retrograde inhibition, anti-inflammatory, and anti-anxiety. All of this stuff is good in terms of dealing with endometriosis and menstrual cramps. The current thoughts on dosage in regards to cannabis is that human and plant variability make and lack of human research because of the United States peculiar laws complicate having agreed upon dosages for any of the conditions that it's useful for. Anxiety, a relatively small dose will take care of that. Same with attention deficit disorder. For pain, as I mentioned, 15 milligrams of THC, probably with 15 milligrams of CBD, is appropriate, as is 50 milligrams of CBD twice a day. Cancer, in order to send it into remission, requires 300 to 800 total milligrams of cannabinoids per day for at least 3 months. Okay. Pardon me for slowing down. There we go. Okay, and I mentioned the CBD dosage. It's, let's say, what we know is limited by research, so we found this out by trial and error. So if you want CBD alone, I have since changed that 15 milligrams twice a day. That should be 50 milligrams twice a day. So there are some side effects to THC depending on the route of administration. It can cause increased cough, increased sputum production. We saw a lot of hyperemesis, that's vomiting a lot, when recreational or adult use was made legal. It's useful. It can cause anxiety, panic attacks, dysphoria, sleepiness. And one thing that's important when you're talking about THC, it can affect driving. I've testified about 200 or 300 times in court for people who've been arrested for driving under the influence of cannabis. Most of them have been acquitted of that charge. Thanks both to the attorney and hopefully some of my expert witness stuff. Okay, treating or preventing these side effects. The common wisdom is to start low and go slow. Use an equal amount of CBD to the THC. Limonene and beta-caryophyllene are helpful in terms of dealing with the side effects if you've got them right now. Street treatment of dysphoria is to bite down on a peppercorn, and you're going to get the beta-caryophyllene in there. Take a warm shower. There's a product called Undo that is helpful in decreasing the dysphoria. And you can also juice the raw plant because you're not going to get any euphoria because the THC is in the acid form. So the routes of administration, both for CBD and THC, are tincture, edibles, capsules or pills, gummies, patches, smoking, or vaping. Obviously, if you're using capsules or pills or gummies and tinctures, you're going to have a better idea of what the dose is that you're consuming. So there's the respiratory route, which has its onset very quickly and can last for 30 to 180 minutes. Sublingual, which onset is in about 10 to 20 minutes. Its effect is variable. And oral, which is onset is going to be 45 to 75 minutes, and effect will last for 3 to 6 hours. Marino Dowd, a reporter for the New York Times, was sent out to Colorado in 2014, and I guess she figured she didn't have to read on the side effects. and she ate a candy bar that had 100 milligrams of THC and less than 1 milligram of CBD. And she was in a fetal position for 6 hours. So don't eat a candy bar with 100 milligrams of THC and little or no CBD. Uh, this You may be interested to know that Dr. Melanie Dreyer, who is I think the former dean of nursing at the school, dean of school of nursing at Rush Medical School in Chicago, she did her study in Jamaica in 1968, and she found that the children of women who used cannabis during pregnancy reached their developmental landmarks sooner than women who didn't, and did better in school. The National Institute of Drug Abuse funded that, but and she followed up in 1972. But after that, they didn't like that her results showed that cannabis was useful, and so they didn't fund any more research for her. Okay, let's go on to the next slide. There was also another study, sort of a study of about 30 different studies that were done on the use of cannabis by pregnant women, and it found no significant harms caused by cannabis if you take it when you're pregnant. Now, one needs to be careful about taking any medication when you're pregnant, but you should know that about cannabis. The CMRC is the California Medicinal Cannabis Research Center, and they did I think 18 different clinical trials, and their results were published in 2012 in the Open Neurology Journal. And they concluded that the evidence is accumulating that cannabinoids may be useful medicine for certain indications. And certainly pain and inflammation are two conditions that the cannabinoids are useful in treating. The Institute of Medicine in 1999, in their report, also indicated that cannabis was useful in treating pain. So today's 4 top takeaways are: cannabis is an effective analgesic for endometriosis and menstrual cramps, particularly CBD and THC. But obviously, there are a number of other cannabinoids and terpenes that are useful. Endocannabinoid system is central to homeostasis and modulates the speed of neurotransmission and downregulates the immune system. Cannabis, with over 150 cannabinoids and 200 terpenes, has a broad range of therapeutic uses, and cannabis has been a medicine for 4,000 years. Cannabis and terpenes work together, exerting therapeutic benefit through the Entourage Effect. Probably people watching this are too young to remember Rodney Dangerfield, but Rodney was a patient of mine, and he used it for anxiety. He wrote a biography entitled "It Ain't Easy Being Me," and his original proposed title was "My Lifelong Love Affair with Marijuana." The publisher nixed that. In his book, he has a picture of him with a piece of paper saying, "Here I am looking at the best piece of mail I ever received, a recommendation from Dr. Behrman telling me to use more pot." That's not exactly. Okay, so this book, you can get it from me at David Behrman at Cox.net. It's written by Maria Petcano, a PhD RN, who recently retired as a professor at Seattle University School of Nursing, and yours truly. And for those of you that are interested in history, Drugs Are Not the Devil's Tools is about a 500-page book that talks not only about cannabis, but about drug laws regarding other psychoactive drugs. And I remember being interviewed on this for a woman from Fisk University in Atlanta, which is largely an African-American university. And I had a long list of groups that were discriminated against because of drug laws, and African Americans were just one. For instance, the alcohol prohibition was aimed at 2 groups: one Italians, one Irish, and the other were the Germans in the First World War. The prohibitionists said we could use that wheat or oats or whatever to make bread for our fighting boys. And of course, the breweries were almost all owned by people of German descent, many of whom had been here for a long time. So I want to thank you very much for your attention. That's my email address, davidbehrman@cox.net. You can also reach me at my office number, 805-961-9988, and the P.O. Box is 8754. I think I got two more right here. Okay, so this is what I just told you. And let's move on to the next slide. Oh, there's some more books, and Candace can send you that if you're interested. Again, thank you very much for your attention. It's a pleasure being here. I look forward to hear what the folks who developed the vaginal suppository have to say, and I look forward to your questions. Thanks for being here to hear the speaking program of the pharmacy.
Wonderful. Thank you so much, Dr. Behrman. I love it. I love how you gave us all that information. So people just watching, maybe that don't know much about cannabis, but want to figure out a different way to treat their endometriosis or painful PMS, they got a lot of information that can help them kind of understand what we're talking about. So this is wonderful. Thank you again. I love all the information that you have in your brain and how you share it so wonderfully with everybody and make it easy to understand. So after learning about endometriosis and how cannabis can benefit those that are suffering, I thought it'd be really good to bring on a brand that makes a product specifically for women that suffer from endometriosis and some other conditions that women suffer from as well. Like we talked about before, like PMS and menopause, premenopause, those types of things. So I'm really happy to have Carrie Mapes and Patty Pappas on with us today. Can you guys tell us a little bit about your story and how you actually came to create this product for people with endometriosis, PMS, and menopause?
Sure. I'm Patty. This is Carrie. So what might surprise you is that neither Carrie nor I had a relationship with cannabis as of 3 years ago. We literally walked into a dispensary for fun one day because we were curious. It had just become legalized in California. And we thought we would go see what everybody was talking about. And that led us down this long path. And thank you, Dr. Behrman, because now we don't have to talk about everything that we learned in those dispensaries at that time, because basically what we found, what you just told us, was that there was a natural solution available to us for the symptoms that we were suffering from as women in menopause, which is, the opposite end of what we were just talking about, but a natural solution for us to turn to for some of the issues that we were having that typically women our age are using, pretty harmful things to help soothe their symptoms, things like alcohol, sleeping pills, anti-anxiety medication. So after education, Carrie and I, we were so excited that there was this natural solution in cannabis, and then we had to find a way to take it, to use it, because we didn't want to get high. And we, tried various methods, and they were a little scary sometimes. They were inconsistent. Something would affect her different than me, or me every time I used it. And we came upon the solution of a vaginal suppository. And first of all, it's just very poetic to use that space, which has been, causing us some pain and issues, or, being used over our lifetime as a source of wellness. But it was a way for us to use THC in a bigger dosage than we normally could through an edible or smoking or vaping or and CBD. And we also have added botanicals in our suppositories, which are sort of a specific terpene profile formulated for Carrie and I were our customer founders. So it was for women our age to help with the solutions. I know we're not here to talk about menopause, but some of the symptoms are brain fog, hot flashes, lack of sleep is a big one, I think, for women most of their lives, anxiety and pain. And then one of the big ones that people don't talk about is vaginal dryness. So as a vaginal suppository, it really gets to hit all that with a higher level of THC and our added botanicals. And it's put right into the spot where it can do the most good. And so that's how we came up with Hello Again. And we started with 2 formulas 2 years ago. We got on the shelves in 2020. And we have 4 daughters between us in their early 20s. We started to hear from them that they were using our, menopause product for their period cramps. And that was the first and their friends were, coming by the house, starting to use it. But when we really realized that it was could be applied for that was when we started hearing back from the staff at all the dispensaries. And by the way, the pharmacy was one of our first dispensaries. And there's a lot of young women on the staff, and they started to, a lot of women with endometriosis. We really had no idea how prevalent it was with young women and how painful. And we started to learn about it. But we heard back from staff at these dispensaries that we were in that they were all using it also for PMS, endometriosis, anxiety, all the things that younger women were having too. So we thought we had created something for our age and up, and then it's really been applied for women of all ages.
That's so cool. I love that. I love your guys' story. How this it's meant for one thing. And again, women are going to deal with that eventually. So it's always good to educate people, when they do have to deal with premenopause, menopause, that there's something for them. But very interesting how you found that this product was also useful for a younger audience, which I always like to tell people too, because a lot of people think, just menopause, but there's so many other things, and women deal, constantly with these issues. So we talked earlier, Dr. Behrman talked about the different delivery methods and how they all work differently. For people that are unfamiliar with vaginal suppositories, can you tell us how they work, how you insert them, and maybe what the expected onset and duration is for that delivery method?
You saw me just look around. I don't have one right here, but basically it's a bullet size and shape.
Like an OB tampon.
Yep. And the base is cocoa butter and avocado oil and vitamin E, which is very soothing. Some helichrysum in there as well, and a couple other things that help, just antibacterial, antimicrobial. And then we currently have 2 products, an everyday and a sleep. So this is, you peel this apart, and here's your suppository. And you can use it vaginally or rectally. Our product says vaginal suppositories on the box, but we know that people are using them rectally as well. In fact, people with endometriosis are using them rectally also, kind of depending on what symptoms they want to address. But so we have 2 products, an everyday and a sleep. They have differing levels of THC and CBD, and they have different added botanicals to create different terpene profiles. So it would be no surprise to anyone watching that, we have lavender and chamomile in our nighttime, which is providing terpenes that help relax and calm. And then we have hops and rosemary and helichrysum in our daytime, which help with other things, temperature regulation, brain fog, pain. Right now, women are using our everyday and our sleep for help with endometriosis. But kind of in a response to the way people are using our product, and Patty and I knew that we could formulate something that was more targeted for younger women for cramps and endometriosis pain and other things. So at the end of the summer, we're launching our newly formulated Hello Again Period. And that one has even more THC in it, and a more specific terpene profile. We really highlight myrcene, linalool, limonene, and the beta carotene. Those are the ones that we were really targeting, because our new period product is really going to address pain, number 1, anxiety, number 2, and focus. So the thought that, it can bring you relief any time of the month, depending on what you're suffering from. So you can use it day and night. You can use a couple a day if that's what you need to do. They melt within about 30 minutes. Some people like to kind of lay down and look at their phone and answer their emails, once inserted in the morning, just to get it kind of melted and absorbed before they get up and going. Some people use a panty liner with them. Sometimes you need to use a tampon with them. I know if you use one and you're going to go out and exercise, you might want to try that. Or if it's that time of the month, it's okay to use a tampon with it as well. But the effects really started happening within an hour, certainly faster than that with the sleep. The sleep, I kind of brush my teeth, wash my face, use one, finish up, get in bed, read 2 or 3 pages, and there's really a calmness that emanates from your pelvis, a real physical calmness. And if you can kind of lean into that, you can go to sleep and stay asleep and go back to sleep if you have to wake up, which I mentioned because if you're suffering from any kind of pain, today we're talking about endometriosis, it can be really tough to get a good night's sleep, which just makes everything worse the next day. So the effects last about 6 hours or so, I would say. And we were just really thrilled that we've been able to provide a solution for a problem we didn't particularly have, but we really feel passionately about. Those numbers are staggering. The number of women who suffer, and the ages of women who suffer, the varying ages of women who suffer from that kind of pain.
Yeah.
But the most important thing for us was, as with the suppository, that we could utilize the THC and no psychoactive high. I mean, no, you can get on with your day. You can go to work. You can drive your car. You can get up in the middle of the night and deal with something, and not have to deal with that head high or worrying from time usage to usage how it's going to affect you. So consistency was a big deal for us.
Yeah, and that doesn't come from some kind of moral high ground.
Yeah.
We just basically that's the product that didn't exist. And then, some women are going to need to use ours to get through the day and layer on a vape or flower or, an edible also for relief. But ours is our product's a really nice starting place when you got to get on with your life.
I want to thank you for talking about both vaginal and rectal suppositories. I was remiss in not including that. In Europe, particularly, rectal suppositories are often used for people who have cancer because they're using high doses, and they have less side effects because the pelvic floor is served by 3 veins, only one of which goes to the liver. The other 2 distributed throughout the lymphatic system or the body fluid. And the reason that it's important is when the THC goes to the liver, it's metabolized into 11-hydroxy-THC, which is several times more euphoric than THC itself. So I'm kind of wondering, I'm stealing, I guess, the question here, but what kind of side effects do women have from vaginal suppositories as opposed to, say, other routes of administration?
We really feel like we found this sweet spot in using as much THC as we possibly could, without creating the psychoactive high. So the female reproductive tract is really dense with cannabinoid receptors, I believe second to the brain. So there's a local application there that we're really taking advantage of. And then the blood vessels and capillaries do absorb the product. We think that's why there's an extended life period, of the positive effects. But really, we really wanted to create a product that didn't have that kind of psychoactivity.
The only feedback after really 2 years on the shelves is maybe possibly a little leakage, because that goes along with your temperature and would be for any suppository that you're using. But other than that, we really feel like we're happy with
Our formulation, for sure.
Yeah.
Now, you were trying to design this to navigate around those side effects.
Yeah. Right.
That's a good question. Good question. So you talked about you like heard from other people about how this worked for endometriosis. Can you tell us about some of the symptoms that it helped them with?
Well, I think pain, anti-inflammation, absolutely is probably the number one thing. I personally think if you get a good night's sleep, everything is better the next day, no matter what you're facing, is better with a good night's sleep. And then also, I think for women's sex life to have, lubrication, moisturization, also anti-inflammatory, as a suppository, also pain relief. It can help with in that area as well.
Yeah, we've heard from women regarding sex. We've heard from women who use our product before, and the THC is a vasodilator, so we're bringing more blood flow to the area, which is helpful. And then also the CBD is a muscle relaxer, so the pelvic floor is helping to relax the pelvic floor. But we've also heard from women who use our product after sex because for their particular endometriosis, there's kind of the deep throbbing pain afterward that is, that can be helped with our product after sex. Definitely, and we keep saying anxiety, but the anxiety of having it hurt is real, and especially in regards to sex. I mean, I think if you're hoping it's not going to hurt, if everything settles down a little bit, it can be helpful. And then we do, I mentioned rectal application of our product because we have heard that women feel really constipated with endometriosis, or they can, and both rectal and vaginal application can help increase blood flow, relax muscles. And, you know, cannabis is such a great plant because it is a little different for every person, and dosing is a little bit, and application is a little bit different for every person, but so you really can kind of, you have to experiment a little bit, and you kind of can craft the way you use the plant that's best for your body and what you're going through at the moment.
Definitely. All right. And then how do you recommend that people use your product for endometriosis? Like if that's the condition that they're trying to treat, would you say like once a day, twice a day? And which formula would you suggest?
I think that, you know, it's really something that each individual is going to have to play around with a little bit. And like Dr. Behrman said, you know, if you feel like you need 50 milligrams a day or twice a day, then you could take, you know, one every 4 or 5 hours. You can't overdose, obviously, as we know. You can't, it doesn't have the negative effect of having too much. So you really just should play around. You know, sometimes you could do some and then use your sleep at night, and that can get you through the night. But it really is individual, and you have to try it for yourself.
And you really can layer with other solutions. So if you want to try our product to kind of prevent when you feel it coming, prevent the inflammation from starting, but then know that maybe at the end of the day you want to layer in with something that does have more of a whole body relaxation or euphoria, that's perfectly fine too. So
that's great. Well, I'm so glad to have you guys on. I feel like suppositories are something that people don't really talk about that often, but it's so important.
They're going to.
Yeah, and another delivery method, you know, that could provide a lot of people relief. So thank you so much for like being brave, you know, taking on that category. You know, it's not one that's going to make you a millionaire overnight, but it's an important one that's going to actually, you know, bring relief to a specific group of people that need that delivery method. So that's great. If you guys don't mind, we can move into some questions. Okay, perfect. The first question is one that Dr. Behrman had. Do you want to ask the ladies?
Yeah, I've heard a lot about vaginal suppositories, most of it very positive. But there was one thing that I read that struck me as a little bit out of place, is they said that vaginal suppositories can interfere with the normal bacterial flora of the vagina. Have you heard that? Is that true, or is that just somebody just singing Dixie?
I'm so glad you asked.
I mean, I would imagine every suppository is obviously different, has a different base, has different ingredients in it, but you can speak to ours.
So we were actually approached by an independent firm, and we didn't know. They tested our product alongside some very well-known drugstore over-the-counter suppositories that are used for yeast infections and douches. And actually ours was every single cannabis product, but ours in particular, we're talking about suppositories right now, did not negatively affect the biome of the vagina. We really did keep a great eye on pH balance. The last thing you want to do is, you know, get a yeast infection because you were treating anything else. So we did really formulate for that, for pH balance. But we also were really happy to hear that we weren't negatively affecting that space, which is not something that that report showed is true for a lot of products that we all would recognize.
Yeah, that are formulated to actually fix those problems that you buy over the counter.
Perfect. That's a great answer. Good to hear that. And that's awesome. It's always good to hear that you passed the test and you didn't even know that you're being tested.
You didn't even know we were being tested.
Yeah.
Okay. All right. And then we have another question. I think this is probably more for Dr. Behrman. Somebody's asking, what is your understanding or your definition of a full spectrum oil?
You know, I'm a physician and not a dispensary owner, and I don't have a definition for full spectrum oil. I would suspect that the women here may have a better answer than I do.
Well, I mean, I again, also, I will have the same disclaimer. My understanding is that the full spectrum oil takes advantage of the entire plant. So a full spectrum oil from one strain is going to have a characteristic different from a full spectrum oil from another strain. Our particular product, we because of the application and because of the purity that we were demanding from the very beginning, we actually built our product up with distillates and with the botanicals and all of the ingredients that are in there. We needed to be very exacting. But I do understand the benefits of the full spectrum oil and how important it can be to look for those products.
Yeah.
Well, as I said earlier, regarding the Nimbin, the whole plant and nothing but the plant.
Yeah.
But every plant is different because every plant has somewhat different genetics, gets somewhat different fertilizer and sunlight. And the idea that cannabis is always the same thing is not true. And so the full spectrum means that you are using all of the molecules in the plant. And you may want to fortify your product with some terpenes or some cannabinoids that specifically are for pain or are for inflammation or whatever it is that you're using the cannabinoids and the terpenes to treat.
Yep, very good.
One last thing I want to say is that isolates are going to have less benefit and less effective than a combination of the constituents of the plant, full spectrum.
And there's a lot of products that are full spectrum, and what it really is like the product matches like the constituents that would be in the plant, so it has the same terpenes, flavonoids, cannabinoids, all those, working together in conjunction to provide the best relief. So that's a good question though. In your guys's, discussions with people that have endometriosis, have you guys ever heard of like particular strains that are good for alleviating the symptoms? I would tend to think that like indicas or indica dominant strains that are a little bit more body high would tend to be good, but I haven't heard of anything in particular. Do you guys have any strains that you've heard kind of are good for endometriosis?
We have not. No, not in particular. I mean, I would just look at it through the filter of the terpenes that are present in the different strains and go from there.
The taxonomy, the terminology, one has to be very careful. I had an expert witness case where somebody should have been given a sativa and was given an indica and ended up in a fatal accident. And she was tried for second-degree murder. The jury hung up 11-1 to convict on that. But the indica is going to have more THC than the sativa, which is going to have more CBD. And nowadays, according to Ethan Russo, a neurologist, and John McPartland, who's a PhD, we're better off using the terms type 1, type 2, and type 3 cultivar because the use of sativa and indica has sort of been watered down because of all of the crossbreeding that has occurred. So pretty much everything is a little bit of sativa and a little bit of indica. So your best bet is to take a look at the ingredients that are in the product that you're buying. How much THC, how much CBD, which terpenes are in it, that sort of thing.
Yep, I would definitely agree. And because, you might see one strain listed on a website is good, doesn't mean if you buy that same strain inside a dispensary like pharmacy or pottery that it's going to actually be the same thing. There's a lot of like mislabeling and, crossbreeding and, although it might be labeled that, it may not be. So definitely like going back to like terpenes and how that's going to be the future of cannabis. I think as we get everybody more educated and up to speed, it's so much a better way to pick your cannabis and to like pinpoint the symptoms that you want to treat and the relief you want to get. And we have another question. Somebody's asking about Hello Again in other states. Do you guys have it in other states, or do they have to be in California to buy them, or like do you have a hemp one that you can ship?
Today you have to be in California to buy it, but we're really excited to share that we will be in the state of Michigan.
Oh, cool!
By the end of the summer, so that's going to be our first expansion outside of California. But we're really excited. Yeah, we're really excited about it.
Yay, Michigan! That's awesome. And Dr. Behrman's book is available nationwide, though. So I love that. Okay, well, that is all the questions that we have from the audience. You guys have done a really good job at giving us a lot of information and, talking about suppositories. And this has been really interesting. And thank you guys all for your time with the presentations and with us here today.
Thank you, Candace.
It's always our pleasure,
Yeah.
Candace.
Yeah. And thank you, Dr. Behrman, and to his assistant, Amy, who's always very helpful, and to the Hello Again team, too, as well. You have a great team that helps put all this together. So I thank all of you guys.
Thank you. Thank you.
Definitely. And then to our audience that's with us here today, thank you as well. This has been a really great episode of the Pharmacy Cannabis Lecture Series. I hope that we were able to share some information that will help you become better informed cannabis consumers, and that the information that we shared will help you find relief. With that, I hope that everybody has a great day and that you stay safe and stay well until the next time. Thank you so much.
Thank you.
Thank you.